Good afternoon, everyone. My name is Don Parkinson, and I'd like to welcome you back to another WSR live streaming session. Today, we are going to continue with our discussions on a variety of topics as we move through the next phase of the environmental assessment process, that is, after the terms of reference approval. Every other week on Wednesdays at this same time, we will discuss a new topic and want to encourage you to provide as much input as possible by calling or texting us with your questions or comments. You can call or text us toll free at 1-844-424-0500. That's 1-844-424-0500. And just to remind people, we are doing these radio shows and streaming sessions to help community members and the general public better understand what is involved in the federal impact assessment and provincial environmental assessment processes, and to encourage viewers and listeners to participate in these two activities. With me today is Marion Tibor McMahon, who is the Deputy Project Manager for ICE on the Webequie Supply Road project. Good afternoon, Marion, and welcome back for another WSR session.
Good afternoon. I'm happy to be back here and talking about an interesting topic today.
Yeah, great topic. It's a great topic, Marion. It's an important one, big part of the environmental assessment. Um, so in today's session, which is called Human Health, we're going to talk about the activities associated with the human health impact assessment studies that are such a big part of the environmental or impact assessment work that's being done on this project. Hopefully, this will help community members understand the purpose of these studies and how important it is to participate actively in these studies. That's what we're trying to do here. We're trying to encourage community members to really contribute to this, to make sure that this impact assessment or environmental assessment is a very comprehensive one. So without further delay, let's get started, Marion. Maybe you can kick things off with a quick run through of what we're going to cover today.
Sure. So we have a lot to talk about today in just our short time here, but we will get through it all. So if our tech team could go to slide 2, please. So first off, we'll just give everybody a little update as to where we are in the process right now. Then we'll dive in and talk about health impact assessments, talk about what they are, what the objectives are of the health impact assessment. Then we will talk about Webequie First Nation as a proxy and talk about that approach there. Then we will go into what an health impact assessment is based on and what the social determinants of health are. And we'll also talk about a First Nations perspective of health and wellness. And just like other valued components, there are criteria and indicators as part of this study. And then we'll talk about gender-based analysis, the steps to conducting an HIA, and then the engagement activities associated with the study.
Thanks, Marion. So let's start off with where we are now in the process. And back on October 8th of last year, we reached a key project milestone, which was the approval of the Terms of Reference, or TOR, which is essentially the work plan for the environmental assessment. And having achieved this milestone, we then moved into the next phase, which is called the environmental assessment phase. And the environmental assessment phase is where really the heavy lifting, the studies are undertaken, the field studies, the effects assessment. A lot of work is done in this next phase. It's the longest phase, obviously. So that was a big milestone on October 8th, and we are now doing consultation with communities virtually right now, but we're certainly able to be there in person as well. But we're doing that on a weekly basis now with communities, and so that's where we are right now. And Marion, why don't you talk a bit now about what exactly health impact assessments are?
Sure. So health impact assessments, they look at the possible effects on a population's health and the distribution of those effects within the community, the population. It's evidence-based. There's a lot of studies that will also feed into this, and data gathering that'll feed into the HIA. And it evaluates both the potential beneficial and harmful effects of a project on human health. So you want to look at health impact assessments as a more holistic assessment, and it's complementary to the risk assessments that are being conducted, as well as the environmental assessment itself. And it looks at health in a holistic manner, looking at different determinants of health, which we will get into later on. So it'll look at things like social, cultural, spiritual, economic, and mental and physical well-being, in addition to environmental impacts and environmental exposures to, say, chemicals in the environment. So it's a very holistic approach.
Thanks, Marion. And let's now move to talk about the health impact assessment objectives. And you talked a bit about this just in the previous slide. So if our tech team could move to slide number 5. The first objective is to provide a clear understanding of possible positive and negative health and well-being impacts of the project. And this is to underline what Marion just said. We are looking at both bad and good potential impacts of the project, because in quite often there are a lot of positive impacts of the project. That's why in most cases the project was considered in the first place, because the proponents of the project see something positive coming out of it. And as with all other studies being conducted as part of the environmental assessment or the impact assessment, Indigenous knowledge informs the health impact assessment. It's a big part of it, feeds into that health impact assessment. And getting that input from community, getting information from communities in terms of previous studies, etc., that really adds value. And we'll get into this a little bit later on when we talk about the participation of the community and the different forms of participation by different groups in the community towards the HIA. So the HIA represents one of many studies that make up an environmental assessment or impact assessment. So together these studies help inform the decision-making process for regulatory bodies, such as the Impact Assessment Agency of Canada and MECP, and they help provide that basis, that information basis from which these regulators can make decisions, informed decisions about the project, whether approving it, rejecting it, or approving it with conditions. And if the environmental assessment or impact assessment is actually approved, it provides guidance as to how the health and well-being of Webequie can be protected and or enhanced. This is a key part or sort of effect of the health impact assessment. They're built into that assessment is you know is sort of a roadmap forward in terms of how things can proceed safely to make sure that the health and well-being of community members is not jeopardized. So maybe now, Marion, we can talk a little bit now about, I guess, the focus of the HIA being on Webequie First Nation. This is a really important point, I think, to get out there so that communities and community members understand. Maybe you can talk a bit about this.
Sure. So Webequie First Nation will be the focus of the health impact assessment, because really the community is the closest to the supply road, and Webequie will most likely experience most of those project impacts, and as you say, both good and bad. And so the assumption is that it represents the greatest potential health impacts from the project. So it's not to say that we're just only looking at Webequie. We are going to be looking at other Indigenous communities in our local study area, as they may too experience some effects, whether that be indirect or indirect effects. And if, unique health effects are identified by other communities, then we will certainly include those issues or those concerns in the health impact assessment.
So tech team, if we can move to slide number 7, please. And we're going to talk a bit about what an HIA is based on. So it's based on what we call determinants of health. And determinants of health are basically factors that can impact health. And there are many of them. And they've been grouped into 3 main groups. The first being biophysical, and examples of those might be air, noise, water. Um, And then there's GBA plus determinants of health. And I'll get into a little bit about GBA plus. If some of you who have been following us and watching our presentations, we've talked about GBA plus. GBA plus is a way of looking at things and conducting activities on an impact assessment or environmental assessment in a way that takes into consideration all groups, not just certain people within a population, but all different groups. So you're talking about men, women, two-spirited people, elders, youth, making sure that when the work is done on an environmental assessment or impact assessment, that it captures a real cross-section of the community. So there are GBA plus determinants of health, and Marion will be talking about those a little bit later on. And then, of course, we have what you call the social determinants of health. And there are many of these. And we have some preliminary ones that we're going to present to you as examples. And those might include housing or healthcare, things like that. So um, there's there's a lot involved in an HIA, but the determinants of health are sort of the cornerstone factors that are assessed as the basis for an HIA. So, Marion, maybe you can sort of take this discussion a little bit further by discussing the social determinants of health for us.
Sure. So the social determinants of health are the non-medical factors that may influence one's health. So these could be conditions that people are born in or, grow, like the environments they grow in, work, live, age, and even wider forces that shape our lives. So, um, the social determinants of health, they represent what are being considered when doing the health impact assessment to better understand what those potential impacts may be on health and well-being. So as you mentioned, we identified preliminary social determinants of health through our scoping exercise, and they are listed here on the slide in front of you. So these could include things like food production, education and learning, work and income, transport networks, diversity, democracy and governance, housing, culture and spirituality, essential utilities, housing, health and social care. So these are all things that are included in the social determinants of health. And through engagement activities, which we will be going into in a few minutes, we will be revising this list of social determinants of health. And if community members, want us to include more of them, we will certainly do that. So we have a more comprehensive study.
Thanks, Marion. And there's a lot there. These social determinants of health, you can see there are many of them. The ones that we've identified sort of preliminarily, there's a lot. And there are others that will be identified, as you mentioned, Marion, you know, through the process of talking to other communities, talking to the Webequie community as well, too. There's a lot to this. The social determinants are a significant part of this HIA process. And if our tech team can move to slide number 9 for us, please. We'll talk a little bit about, and I'm glad we have the visuals here so we can show this diagram to people. And this represents sort of a way of capturing the First Nations perspective on health and wellness. And you can see the innermost circle being the human being, and then around them are other circles. So around the human being would be emotional, physical, spiritual, and mental, and then beyond that, wisdom, respect, responsibility, relationships. There are a lot of factors involved in that help define health and wellness, and I think this is a really important diagram to have a look at. I would say. So overall components being physical, emotional, mental, spiritual, respect, relationships, responsibility, wisdom, family, lands, nation, community, environmental, social, economic, cultural. There's a lot there. It's very complex. Health and wellness is not defined easily, and therefore requires a lot of attention, which is why, that's one of the reasons why we have so many preliminary social determinants of health, because so many of these define what health really is. So yeah, that's something to really keep in mind, I would say. And Marion, maybe you can tell our listeners and viewers a bit about the preliminary biophysical determinants of health, because there are many of those as well.
Yes, there's many of those physical determinants of health. And those, we have a few of these studies going on right now, and that information is going to feed into this health impact assessment. So we would be looking at air quality, understanding if there are any changes in air quality, during construction and operation. With the road in place, there may be some vehicle exhaust emissions and dust emissions during construction, greenhouse gas emissions, and as well as nuisance exposure to air quality during construction. So we'd be looking at those aspects. And we would also be looking at noise. Again, if there's any changes in noise levels and any nuisance effects during construction. We would also be looking at vibration, if there's any changes to ambient vibration during construction and operation. We also look at surface water and groundwater, looking at the quality of it, if there's any contaminants in the water. And then we would be looking at the same thing for soil. And a big part of it too would be country foods, looking to see, what the quality is of the country foods that Webequie is consuming, and if there's any contamination there. And looking if there's any changes into the quality of the country foods, and as well as quantity and availability. So we're doing those studies right now to collect that baseline information for our health impact assessment.
That's right, Marion, and I can say that community members have actually helped us with the country foods area of this work by providing us with flesh samples of different species of mammals, including caribou, moose, rabbit, and partridge. And then we've gotten flesh samples from species of fish that are eaten regularly by community members too. So they've helped us, gather those samples. They've helped us with surface water and groundwater field studies as well too, looking at the quality of surface water. We focused on where the road crossings are potentially will be. We've drilled a number of wells across the study area as well too, where we're looking at groundwater levels and quality, chemical composition of groundwater as well too. So, and I know we've set up noise monitoring stations in the community, just outside of the community, and then further along the road as well too. So we've been quite busy looking at the biophysical determinants of health for sure. So let's now talk about the GBA plus determinants of health. And before we do that, let's start with a refresher on GBA plus. And I talked a little bit about this before. GBA plus is a mandated or required approach under the Federal Impact Assessment Act. It recognizes the historical and current power structures being things like laws, policies, governments, and other institutions that have shaped society and created unfairness, inequalities. So, you know, this GBA plus approach is really important when you think of the sort of the colonial legacy and the impact that's had on Indigenous people, and more specifically in Indigenous women. And as I sort of mentioned before, the purpose of it is to engage and identify and address like those effects on those those groups that haven't previously been very well represented. And so these are groups like women and youth and elders and two-spirited people and other groups that might be considered vulnerable. So this approach is a really good approach. It is expected that this approach be applied to every aspect of an impact assessment as well. So, pretty important consideration here. And I think, Marion, maybe now you can walk us through the preliminary GBA plus determinants of health, and that's safety of women and girls.
Sure, yeah. So, as Don mentioned, GBA Plus will aim to engage and identify those different perspectives and diverse effects that women, youth, elders, and other vulnerable groups in the community may experience. And they differ too between groups, so it would be good to have those perspectives and ensure that we are assessing these effects thoroughly. So safety is one of the determinants of health through that GBA plus lens. And we would be looking at things like domestic violence, sexual and physical assault, perceptions of safety within the community, crime rates, rates of substance abuse, and even supply and demand of emergency services. And these are all things that will be assessed in the health impact assessment.
So let's now look at the steps involved in an HIA. If we can bring up slide number 13, please. So there are six main steps. The first step is called the screening step, and in the screening step, that's basically a step to identify whether an HIA is even required. Um, and so obviously we've passed that step now. It is required for this project, and then the next step after that is the scoping step, and what scoping means is identifying what is going to be done. So the plan approach, identification of the preliminary health determinants that are going to be looked at, and then the methods associated with looking at them, and then sort of at the same time in parallel with scoping is the assessment and appraisal step, and this is where potential impacts to health and the distribution of those impacts is looked at. So scoping and assessment and appraisal sort of happen in parallel to some degree with each other, and then the assessment and appraisal helps feed the scoping part as well too. So these two sort of work kind of together. And then after the assessment and appraisal step, we move on to recommendations. And the recommendations is an important area, and that's where the strategies are developed and suggested to look at, to sort of accentuate the positive impacts, to make those positive impacts better, and then either limit, control, or eliminate the negative aspects that have been identified. And then following that, there needs to be communication of all this. So that's the reporting step where results are communicated and recommendations are made to project stakeholders and to the decision makers, the regulators, the ones that that make the decisions as to whether the project can go ahead or not. And then finally, and definitely last but not least, is evaluation and monitoring. And in the evaluation and monitoring stage, you evaluate the impact and effectiveness the assessment. So it's sort of a report card, a way to check back on the sort of accuracy of the prediction of impacts, positive and negative, and track those changes over time, just to make sure that everything is sort of unfolding without too many negative things happening beyond what was anticipated. So there's a lot of steps involved in an HIA, and it certainly doesn't happen overnight. So now, Marion, why don't we talk about another key activity in the HIA? And this is a big one, and it's called engagement. So maybe you can run through that for us.
Sure. So we have a lot of engagement activities planned out with different groups within the community to collect our baseline information for the health impact assessment. So we have 5 groups that will work together as part of the HIA. So obviously we will be working with Webequie community members. They will be filling out a health survey to answer a few questions for us to have a better understanding as to what those health conditions are in the community right now. We will also be holding some focus groups with the different groups of the community, so that being women, youth, elders, just to gain their perspectives as well, following the GBA Plus framework. We will also be doing some key person interviews. We've already done a few interviews already to start building our health baseline. We spoke to the health director at the community, we spoke to chief, we spoke to an elder, as well as some council members as well. So we're getting some good information there. And we have an HIA technical team as well that'll be part of this, leading all the activities and ensuring that we are collecting the right data and information for our health baseline. And we're also going to be developing an HIA steering committee, which will have a few people from the community, as well as from our technical team and our EA team, to help guide the HIA study. And so we strongly encourage community members to participate in the survey, the steering committee, our focus groups, because it's important for us to capture as much detail as possible for our baseline study, because we need to understand what those health conditions are like right now from the community, so that way we are better able to predict those impacts, whether that be both good and bad. So we look forward to working with the community in the future for our baseline.
Thanks, Mary. And what you just said there too. I mean, those 5 different groups. That's a real cross section of
Mm-hmm.
people in the community to draw from, isn't it? So, hopefully we'll be successful in being able to get information from each of those groups. And like you said, if we're able to, I think we're going to be able to get a pretty accurate picture of the way things are right now, which allows us to give a better picture of things will be what things will be like once the project is built, if it is built. So that wraps up today's WSR discussion. We want to invite you to join us again in 2 weeks when we talk about the air quality, noise, and vibration studies. And please don't forget to visit our website at supplyroad.ca or visit us on social media at WFN Supply Road. So thank you, Marion, and thank you to
Thanks
our
for having
viewers
me.
and listeners and Miigwech, and we will see you again in 2 weeks.